So, are we ready to go?
Yeah, good.
Yeah.
Good.
We are rolling?
We are at the Apex Board Review Course 2018 and we have the pleasure of talking to Dr. Patrick Walker from the Aracana Laboratories. So sir, the most important thing which everyone on Twitter wants to know is what is Trumidor?
Oh,
Like I have actually googled it. I thought it is some renal pathology stuff which I don't know. So what does it stand for?
at Troubadour is what one of my children named me as part of a video game called World of Warcraft, which some of you may have heard. Now, I didn't play World of Warcraft, but they've been playing it, and they said, Dad looks like a Troubadour. I said, what's a Troubadour? I said, why don't I just call you Troubadour, Dad?
That
So
is
that's,
awesome.
I've become at Troubadour.
That is
for
just
that.
awesome.
No, it's not. You know what? We should name a pathologic condition after it.
Yeah.
Great
The
strangeness
Troubadour
of meetings.
syndrome or
Yeah, that's it.
Yeah.
So look out for Troubadour syndrome in the future.
Yeah.
That's right.
Yeah.
We're going to publish on
So
it.
before we move on to the next question, what do you take before your classes? Like, what's the secret ingredient? Why are you so energetic?
Believe me,
Actually-
he's been teaching since morning 7:30 and it's like
And he's been-
8:30 in the evening and he's still full of energy.
And full of energy, and he's been walking right across the room,
Yeah.
and he's been running. He's not been walking. So,
he has almost managed the whole conference today. So
Look, here's the secret to any good teaching. Love your students. And by love your students, I mean love Dr. Chapman. He's a student just as much as I am. Love your students and you will do your best for them. And that's 90% of it. The other 10%, 10 to 15% if you remember Walker's Law, is organization. Organization. So what I bring to the table is great enthusiasm and love for the discipline that I share. And it's a joyous sharing. It's not fun. Yeah, we had fun, there was laughing, but I think there was also a sense of joy. How do you actually accomplish these tasks? And that is a joyful experience, not an amusement park ride. That's fun, but joyful. It's more like holding your grandchild, in my case, or when I was younger, my own children. There's joy in that. So I hold students with that same love. The same thing you should do with your patients. And I mean that in all of the best senses of that word. Now, so with that love, the other thing is you have to have humility. I don't care if I look like a fool, which I do. I frequently do. And, that can bring up a certain level of discomfort among some people, but it doesn't bring it up. So two things. Love the students, let that joy shine, and bring an organizational structure. Have something to say. That's where it comes from.
during one of the talks, you were very passionately talking about telepathology. Whether you want to elaborate on it?
Okay, telepathology is starting to come into the United States, and it's been approved on one instrument. It's, again, these people go patenting things and all that, but it's going to become widespread. It will be gigantically helpful. We're now able to scan a whole slide in about a minute at low res. For a renal biopsy, it takes about 8 minutes, which is great. So now, if we have somebody who can prepare a slide well and scan in a tray, it's going to take them about 8 times 10, so 80 minutes to get it all scanned in. But now I've got it on the computer. I can read it. So if you send it to me, I'm looking at it just like I was at home. Well, I am at home, but just like I had a microscope. That's where we're going with telepathology. This will greatly aid diagnostic interpretation by expert analysis. And again, I've done this a long time, so I'm pretty good at it. So this is wonderful, and that's the good news about telepathology. Downside, still takes some time. But here's the other interesting thing. I've looked at telepathology from the very first one in 1996, and it scrolled down my screen like this. Here comes the slide. Click. Click. I mean, literally, I've gone to get coffee. Click. And I had to go 6 flights down to get it. Click. Nowadays, I pop it in there, I move it around, it's just like I'm looking at it under the microscope. I'm just sitting there with my computer screen with my mouse and my hands on the keyboard, and I'm looking at the slide. Oh, I want to make it bigger? Click, 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 it's bigger. Down, down, down. It's just like I do a microscope. It's wonderful. And you can tell I'm a little excited about it. This is coming. We're already doing it. It's greatly exciting.
it truly is exciting. Some of our pathologists in the south are actually started doing it. Dr. Mahesha has actually started doing nephropathology using WhatsApp, and I'm sure we're putting this on Twitter, so he'll have a lot to say about this when he has a look at this.
And
So-
in future, we also look forward to send our stuff to Arakana so that we can get your opinion about it.
Right now, we do pictures like I showed. I'm not getting the whole picture when we do pictures. So I get consults with pictures. It isn't the same thing. This is going to be spectacular.
Absolutely, yeah. So moving to the last question, how important do you think pathology is for a budding nephrologist?
So let's talk in two stages then. So let's talk about a trainee. So we have a trainee. You're not a trainee. But when you have a trainee and a young person, to understand glomerular disease is a very visual thing. To understand tubulointerstitial disease is very visual. Vascular is very visual. I can tell you, when I looked at those HLA panels, they're not visual. I looked at those and I started to go, I can't focus my eyes. There's so many of them, right? When you look at those glomeruli, it's a very visual thing. It gives you a gut feeling for your patient. It's like going down to look at ECMO. You don't have to anymore. I always forget. You dial it up on your computer. You're looking at your real X-rays now, right? There's something about looking at that film that makes it more real than looking at a report. Same with pathology. So to me, because it's so critical that you learn this type of stuff, you must have basic pathology. Now, for a practicing nephrologist who's very busy, we put pictures up on the web. We could put scanned images up. We do that for some people. It's very helpful because for them, at 10 o'clock at night, they're exhausted. They're too wound up to sleep, and they go, let me just see what Walker said again. He opens up the Arcana Lab website, goes and says, oh yeah, Susie did a biopsy too. So he looks up his partner's biopsy. They're looking at the reports and they're looking at pictures. So that visual image reinforces what we're saying. To me, it's critical.
So
So do you think that every nephrology teaching program should have a pathology course also imbibed in it?
I do. I feel very strongly about that. And the problem, of course, is there are few renal pathologists to go around, even in the U.S. So we're now working with 4 different medical schools, and all of their fellows come to Arcana, and we go there and give teaching renal biopsy conference, but they also come to Arcana, spend time with us, doing nothing but studying pathology, and they're the people we scan slides for so that we can teach on the web. Very important.
Thank you so much, sir.
Thank
Thanks a lot.
you.
So basically, you've seen the Trumidor in action,
Yeah.
a glimpse of what has happened today. So you can always go back and see the video which Divya's put up. And
Yeah, we have live tweeted the whole talk which sir has given. It is available on Twitter with #EpicsBRC_18.
it is a must watch. You have to see it.
I'm going to see it again.
Thank you very much.
Thank
Thanks
you
a
so
lot,
much,
sir.
sir.
Thank you.
Thank you.